Just tell me a little bit about where is Remba, first of all?
So Remba Island, it's in Kenya, in Lake Victoria. Lake Victoria is the second largest freshwater lake in the world, and ironically, none of it's good for drinking unless it's treated. So there's this tiny island off the coast of Kenya in Lake Victoria, which is basically a flat rock, which has anywhere between 5,000 and 10,000 people living on it.
Now, the population in Remba changes, doesn't it? At certain times, there's only about 4,000 or 5,000, and then it really swells to how many?
Right now, it's at its highest that it's been probably ever. It's about 10,000 people right now. It changes a lot depending on where the fish are in the lake, and also the fishing season. At some points, the fish are the fishing is closed. So people will go back to their rural homes to farm or go to other places on the lake. And some people will be there for a day or two, some people will be there for months or even years. But the thing about Remba is no one really considers it their home, which makes it a challenging place for these types of projects. People are always there just for work, and if they have extra money, then they'll invest it back in their rural homes.
Yeah. Tell me a little bit about when you were talking about you come across maybe once a week or twice a week in a boat, and that up until the point where you had a structure that was you were able to build through donations for some people in Texas, that you were setting up just all sorts of different places just to kind of make it a makeshift mobile hospital. Tell a little bit about that.
Yeah, so when I first moved to Kenya, it was really to help run an HIV program called FACES, which stands for Family AIDS Care and Education Services, and that was funded actually by one of President Bush's initiatives called the President's Emerging Plan for AIDS Relief through the University of California. And our job has really been to help make HIV services accessible in the rural areas where people can't get HIV prevention or treatment. And so Remba Island has very high rates of HIV, and was one of the priorities that the government identified where they needed help. And it doesn't have any health facility at all, or it didn't at that time. So we would go once a week, or we still go once a week for a mobile clinic. And we just have to use whatever building we could find. So at one point we were using a hotel, and the hotels in
yeah, it's
Remba,
not our idea of a hotel, is it?
Yeah, basically every structure on Remba is made out of iron sheeting. So they're just these plain iron sheeting walls without any wall boards or anything like that, and very small rooms. The hotel room basically just has enough room for a bed, and you can't even open the door all the way most of the time because there's not enough room.
Oh, gosh.
So we'd use the hotel room for our clinics. We'd each take a different room, and the bed would be the exam couch, and then at the end of the day we'd have them change the sheets, and then that's where we'd sleep for the night. So
I can't even imagine. I can't even imagine. Yeah.
And then at one point we were also using a bar, but we'd hang a curtain across the end of the bar to get privacy, but we'd have to finish the clinic by around 3 because then the fishermen would come back and start drinking, and the bar had to stay open because that's how they made their money.
Yeah.
But we were lucky. Some very generous people from Texas actually visited Remba Island and helped fund putting up a building there. So there's a health center there now.
So you've got a structure now.
Yeah.
That's there.
Yeah.
But now you don't have anybody permanent there right now, do you? Because again, the water is not good. There's no sustainable water system, which is one of the things we're all going to try to do together for you, so they can have a permanent health care person really there, right?
Exactly. So the FACES, the HIV program, still goes there once a week, and at least we have a nice building to run the mobile clinics, but the government can't post staff there because the living conditions aren't adequate for it. So so we need a staff housing, and we need something that has safe water for the health staff and sanitation, because sanitation on the island is also bad. So with that, we expect that the government has committed to posting a nurse, and then if we have someone there full-time, it means things like regular child immunizations and treatment for malaria. All of those things will improve on the island.
One of the things that I want to express again is that we have a major horse show coming up in September of this year, the 14th through the 18th. It's the Texas Rose Classic in Tyler, Texas, at the beautiful Texas Rose Horse Park. And it's an aid show. It's beautiful. It's 5-6 days of rolling hills. It's a beautiful area. I hope someday that you can come out and see it while you're here.
Yeah.
And please join us for 2 or 3 ringside events. We will be there. We're going to have silent auctions with all sorts of things that are donated from friends of yours, from friends of mine that are people who are all over the world, because riders and equestrians get around too, and these things, you know, they're important to them. So we're hoping to have some great fundraising events.